Thank you so much for watching. Welcome to researchmd.com. My name is Dr. Pramil Cheriyath. I'm a program director of internal medicine residency, transitional residency. I also work as a director of research, and I hold a couple of assistant professorships from two major universities. Today, our topic is descriptive statistics versus inferential statistics. Okay, two basic terms in biostatistics or statistics we should be very familiar with it. So we will start with the first thing we're going to talk is the descriptive statistics. What is descriptive statistics? Just like the term descriptive, you're describing the data. Okay, so let's say you go to a you got some data about this car dealership or like a used car dealership. They sold 1,000 cars like last month. Okay, so you want a description of the data. How many of them were like Nissan? How many were Toyota? How many were Lexus? And you can say, what is the age of the people, what is the mean age of the people who bought the car from there? What is the mean income of the people who bought the car from there? Okay. It also, when you talk about, when you talk about descriptive statistics, you're making a large data and you're making it very simple. You're organizing it, you're displaying it, and you're making it people to understand like better. So when you have a large data, you're summarizing into a small table. Hey, this is the descriptive statistics. Okay, you're reducing the data. When I said when we talk about reduction of the data means, again, a large data set, you're reducing into small numbers so people can understand much better. Distribution, when you talk about distribution, we're looking at the frequency of data. This is the mean age, or what percent of the people are male in the data, what percent of the people are female in the data, okay? And then we talk about central tendency. Everybody know about central tendency. We're talking the famous mean, median, and the mode, okay? So any large data set, when you do descriptive study, you're definitely going to use those three terms about the central tendency, which is mean, median, and the mode. And the last thing is the dispersion. The dispersion of the data, two main things are in there. One is the range and the one is the standard deviation. You also wanted to describe using the range or standard deviation of the data. Okay. So next thing, I recently did a study. So about I published a paper about Takayasu arthritis, and any scientific paper, if you look at it, the first table you always see is the descriptive table about your population. So it's a prime example of how we display the descriptive data. If you look at it, if you got the age of this group, the mean age was 25, okay? Then you have next to it, you got the standard deviation. Again, we talk about descriptive statistics. What did we talk about? Using central tendency, which is the mean, medium, and the mode, right? And then you talk about the male. What percent of the people are male? Like 15%. Then I talk about female. 38% are like females. And fever, 20% have female, and the chest pain in this people have some people have chest pain, and then syncope presented with a 6.98. So I'm using all my tools just to describe the data. This is what the data, so the people who are reading or people trying to understand, they have a brief summary of the data set, okay? And now we talk about inferential statistics. You using the descriptive statistics and using strong statistical models for making the inferences. I will say a prime example. Let's say again we talk about this car dealership. They talk about they sold 1,000 cars. You're trying to make an inferences high income people will buy most expensive model, right? And or you can say, my sales, let's say I sold 1,000 cars this month, and I want to forecast the data and use that, what's my sale is going to be next coming month, or 1 year later, what is going to be. So I'm predicting that, okay? So you can use inferential statistics to make decisions, inferences, predictions and also forecasts. We talk about the forecast, like a stock market, like what's going to happen in 2024 or 2026 or 2030. Every year we can use the statistical models to predict that. The most common, the simple thing to do, let's say we have a quantitative data, we can use the t-test. If there is, let's say if there is like a categorical data, we can use the chi-square test. And these are the common, like simple statistical tests we can use. And then you have, you have linear regression, you got logistic regression, you got ANOVA. There's so many other tests you can use to use the data to make the inferences. Is there a relationship between two variables? Let's take a look at it. Is there lung cancer and smoking? You're trying to make an inference of smoking and causes lung cancer using the different statistical models. That's what we use it for, okay? So finally, you making a conclusion. You have all this data, you analyzed it, you want to tell people, you concluded. Most of the scientific journals, they will not take your paper if you don't have inferential statistics, or you create like this model of logistic regression, linear regression, to come up with your scientific basis for your hypothesis, okay? And the next thing is, like I did another study looking at the association between the pulse pressure. When you talk about the pulse pressure, is the difference between the systolic and diastolic blood pressure. And what is the outcome in a group, in a large number of patients admitted with sepsis and their mortality, okay? So in this model, I used the logistic regression to make a prediction or to make a connection, the relationship between the pulse pressure and the mortality. So what we found out, if you look at it, we got the odds ratio right here in this model. We saw the pulse pressure greater than 70 is associated with a significant decrease in the mortality based on the p-value less than 0.05. Okay, so in that model, we adjust for other covariables also, high blood pressure, sex, race, age 65. We adjusted that, and we still came up with the most important part of our paper, the prediction. If the pulse pressure greater than 70 associated with a significant decrease in the mortality. Okay, so to summarize everything, descriptive statistics, we just describing the data and put in the small numbers, or describing it, what exactly the data is about. When it comes to inferential statistics, we making the conclusion, or we making the forecast, we predicting, or we trying to create the relationship, or we just kind of say smoking is kind of related to the lung cancer. Okay, so always making the conclusion about the data, and that's what all about inferential statistics. I hope everybody learned about descriptive statistics and the inferential statistics today. Thank you very much.